Good morning, everybody. My name is David Stenstrom. I'm the Senior Medical Director and an internal medicine doctor with Pacific Source. I work in the Portland office, and I have with me today our Chief Medical Officer, Dr. Edward McEachern. Good morning, Dr. McEachern.
Good morning, Dr. Stenstrom. By the way, I'm also an internist and a pathologist, and I work out of our Boise office. It's good to be with you, David.
It's good to be with you as well. I thought today it'd be great. There's a lot of information coming out about the COVID-19 vaccine, and I thought it'd be wonderful to ask you some questions and see what your thoughts were around the COVID vaccine and some of these frequently asked questions and concerns that people have.
That'd be great. I'd love to have a dialogue around that.
The first question I had, and I find really interesting, is there's a lot of information on social media, on news outlets, all sorts of different places. And I'm wondering how you distill the information and where you get the information that you find reputable and you use in your everyday practice and talking with people about COVID-19 and the vaccine.
Really good question. One of the things that I go to often, there are a couple of sites that I like a lot. One of them is the MMWR, the Morbidity and Mortality Weekly Report. It comes out by the CDC. It's a published thing, and by the name, it's published weekly, and that actually sometimes more than weekly. And it's a very good document that describes real data about what's going on in real time. And it's a peer-reviewed journal, and it's also well referenced. The second site I go to is the World Health Organization has a site so that every data set and every article that's published around COVID is actually logged there. Some of those are peer reviewed and some are not. Most of those journals are open access, meaning that you don't have to pay to see them, especially around COVID. And it's a big scientific effort for people to look at right now. And the scientific community is working very hard to make accurate and valid, reliable, and predictive data available. And that's a great site too, the World Health Organization's COVID-19 data set and literature review board.
It sure is a lot to keep up with, isn't it?
It is. I get paid to read full time, pretty much.
So tell me, one of the questions a lot of people have is how does the COVID-19 vaccine work?
And what's in it is another one that I get a lot. Well, it turns out we made a video about that. One of the people we work with, Jenny, has done a really good job of telling that story in pictures along with the data that we pulled from the referee databases and put together. And so we'll put a reference in here to that website so you can take a look at it. It's about a 10-minute video and it describes very clearly how these things work. Long story short is there's a thing called mRNA, which is sort of like the Snapchat of DNA. It's a wee little piece of instruction, and it gets into not the nucleus of a cell, but the cytoplasm, and it tells the cell to make the spike protein. And the spike protein is those little spiky things you see on the pictures of the COVID. And those things go into your body and they elicit a immune response. And there are two types. One of them is a memory response. And the second is T killer cells. These cells, these white blood cells come along and they either capture or kill the virus. And so what you're trying to do is create a memory of it. It's sort of like Sasquatch. Everybody knows what Sasquatch looks like. Nobody's ever seen one. But what you're trying to do to your body is give your body an idea of what that COVID-19 little virus looks like.
And will the COVID-19 vaccine give me COVID?
No, it can't. The COVID-19 vaccine is really not the COVID virus itself. It's just a wee little bit of it. It's actually, it produces the spike protein, not the whole virus. And so it doesn't have any way to produce the virus itself, and so it cannot give you COVID.
Well, thanks for that. So there's 3 different vaccines I think we hear a lot about in the United States: Pfizer, Moderna, and Johnson & Johnson, or J&J. And one of the other questions is there's a lot of stuff that goes around of what's contained in a vaccine. What are in these vaccines, both active and inactive ingredients?
All 3 of these are very interesting vaccines. And by the way, this is using a technology that when George W. Bush was in the White House, he said, we probably are going to experience a pandemic of this nature. And he put into place the structures and mechanisms that create the ability to produce a vaccine very quickly. And it's been used by the Bush White House and every subsequent White House, the National Institutes of Health, NIH, and the FDA. And so in these vaccines, it's actually a very novel vaccine. What they've done is they've created a lipid or a fat container, and they've put this little piece of mRNA inside that container. Now, one of the struggles is that when that container gets into your body, you want it to hit the cell so it can produce the spike proteins without getting killed first. And so the reason that the Moderna and the Pfizer vaccine have to be so cold is that lipid little shell, that lipid delivery mechanism is fragile and needs to stay cold for a period of time. J&J, not so much. They're very good. By the way, all these vaccines have gone through all the process for the FDA to get approved. They are not experimental. The Pfizer has full FDA approval. Moderna and J&J are on deck to be approved. It was a massively coordinated effort with many efforts done by public and private pharmaceutical companies and researchers. The data is all public and it's all published. And if you want to see it, you can actually go to the WHO site and take a look, and it will be there. 300 million doses in the United States, about 1 billion doses given so far in the world.
Now, one of the frequently asked questions sometimes seen is if COVID-19 vaccine causes you to be magnetic. And so, reading through, I believe that COVID-19 vaccines contain no ingredients that can produce an electromagnetic field at the site of your injection. So they're free of iron, they're free of nickel, cobalt, lithium, rare earth alloys, and any manufactured products such as microelectronics, electrodes, carbon nanotubes, and nanowire semiconductors. Would you agree with that statement?
100%.
Good. Is the vaccine experimental, Dr. McEachern?
No, like we were talking just a minute ago, it's been through all of the FDA, the regulatory compliance pieces of it have been done, but they've been done very quickly. And the EUA, the emergency use authorization, is given so we can get by the FDA, so we the public can take the benefit of the vaccine before it goes through all the paperwork that it needs to have. Now, Pfizer's already been fully approved. It's no longer an EUA. It's actually under an FDA advisory recommendation for use now, just like any drug or vaccine. J&J and Moderna are coming along right after this.
And there's additional regulatory bodies that look at this in addition to the FDA. There's also a Western States Scientific Safety Review Work Group, isn't there?
There is, and then also comment about how the CDC has a registry of side effects.
Oh, I'm glad you brought up side effects. One of the questions that are going around that people sort of think about is if these vaccines have any harmful side effects. Could you comment on that?
When you get a vaccine, what you're doing is you're turning on your immune system. Like we've noted before, you want it to produce these spike proteins and then recognize them and then kill them. And kind of what you're hoping to have is a revved up immune response, and that is kind of like getting a little bit of the flu. And so commonly, people have side effects. 22.4% of the people will get headache. About 16% of folks will get dizziness. The severe side effects are really, really rare. So clotting in J&J, you've heard about, is about 1 in a million. And the good news is we actually know that it's mostly in women in their third decade, and we actually now know how to treat that. It's a known and understandable and predictable side effect, and we know how to treat it. No one has died from that yet. The other one is in a study that was done by the CDC and then published in the MMWR, the Morbidity and Mortality Weekly Report. Of 14 million doses given, there were about 7,000 adverse events. Now that might be a little bit of anaphylaxis, like people getting a little shocky. And there were 640 out of 14 million serious events. So that's 0.005%. Now, a serious event is something like a chills and bad fever, or feeling like you're going into shock. There has been no causal relationship between COVID vaccine and any of the 3 vaccines in death out of this MMWR published in February.
And I imagine even the severe side effects can be managed probably fairly easily with the provider.
That's what the data suggests. And there were 19 of those 14 million were really severe. None of them actually got admitted to the hospital, and all of them were treated in the ED.
I'm fairly young still, and I think healthy. Um, why shouldn't I just take my chances with COVID? Because it seems like a lot of people, they don't necessarily get really sick with COVID. Why should I take my chances with the COVID-19 vaccine versus, getting COVID myself?
First of all, the vaccine's a lot safer than getting COVID. And then the second thing is that, somebody will ask, well, doesn't getting COVID confer immunity to COVID? And yes, it does a little bit. But when you look at the data that they have, when they compare the people who've had COVID versus the folks who have had the COVID vaccine, it turns out that one of the things that the COVID vaccine does much better than COVID itself, and this is kind of like they don't know why this happens yet, but the COVID vaccine it introduces the spike protein in a way that your B cells, which are these white blood cells that are memory cells, they hang out and they remember looking at that spike protein. Those B cells, if you've had the vaccine, are much better at recognizing COVID than the native form of getting COVID itself. The second thing that's kind of interesting is that people who've had COVID and who have long haul symptoms, those people who have these persistent signs and symptoms of the COVID after the 14 to 21 days that the disease normally runs its course, once they get, and this is in the Pfizer vaccine that I've seen results only, but once they get that vaccine, their signs and symptoms abate, and they seem to come out of that long haul in a much, much faster and better way.
You mentioned earlier about the way that COVID vaccine gets into the cells and that it stays out of the nucleus. I was wondering if you could talk more about that and also answer the question, will the vaccine incorporate and change my DNA?
That's a great question. So RNA is like Snapchat to DNA. So if you were to think about RNA and DNA and compare them, and this is an important point you have to kind of get before I can talk about this, but RNA is kind of like if I had a stack of blueprints that described a house, and that would be like the DNA for the house. One page of that blueprint that describes a door would be the RNA. RNA is just sort of like the Snapchat of DNA. And what it does when it goes into your body, your DNA is contained in the cell nucleus. It's in the center of the cell, and the nucleus has a wall around it. The RNA enters into the cell cytoplasm, but it doesn't get into the nucleus itself. And so it has no way to get in contact with your DNA. And not only that, there's no way for that RNA to get written into your DNA. Usually how it goes is your DNA transcribes something to RNA and the RNA makes a protein. So it rarely, if ever, can go backwards. By the way, we've been using RNA viruses since the 1950s. The Sabin and Salk polio vaccines are RNA vaccines, and they're actually the polio virus itself, and they're attenuated, which means that they've been killed and damaged in a little bit of way, and then they're introduced into your body. So it's been around. This RNA technology has been around for a lot of years. It's a really great question, David.
So, Dr. McEachern, another concern or question that people have with respect to the COVID-19 vaccines is whether or not they contain human fetal cells. And I was wondering if you could comment on that a little bit.
That's a great question, David. No, they do not. A little history here that might be helpful. Back in the 60s, maybe even into the early 70s, there was some of these fetal tissue cells were used to develop vaccines. They haven't been used for vaccines for a while. In this vaccine, there are no fetal cells, aborted fetal cells or other fetal cells used to create this vaccine. In fact, there's a guy named Bishop Kevin Rhodes, who's the chairman of the Conference of Catholic Bishops Committee on Doctrine, which is the Supreme Committee in the Catholic Church that makes decisions about whether things are doctrinaire or not. And he said in a recent YouTube video, and I'm going to quote him, he says, all the COVID vaccines recognized as clinically safe and effective can be used in good conscience. And so what that means is that not only is the science pretty good, the Catholic Church in its Doctrinaire Supreme Advisory Committee has said these things are good to use in good conscience.
Let's switch to mothers and expectant mothers and fertility. Is this vaccine linked to any kind of issues with infertility that we know of?
That's a great question too. So there's two parts to this answer. One of them is that you can take a look at, we can study infertility in a couple of ways. One of them is in women who've been exposed to COVID or the vaccine, and the second is in the lab. So Israel, as you might remember or might know, has almost 100% of its citizens who live in Israel vaccinated, and a lot of this work is coming out of the fertility world that's very well developed in Israel. And this researcher named Bentov recently, actually in the last couple of days, produced a paper where they were looking at ovarian follicular function. Now, what is ovarian follicular function? That's when how a woman's ovaries produce this egg that will be fertilized and turn into a fetus in a human. And they actually looked at the function in women in vitro and in vivo, so in the lab and in people. And their quote was, ovarian follicular function is not altered by SARS-CoV-2 infection, so by COVID infection, or by mRNA COVID vaccination, which is all the vaccines that we've been talking about. So that's in vitro when people look at those and study those in the lab. ACOG, the American College of Obstetrics and Gynecology, is the group of people who are sort of the organizing body for the OBGYNs in the world. And they actually do great research, and they actually produce advisory opinions and position statements based on that research, so that all the OBGYNs can understand the best data. So in late April, they produced an advisory about this as well. And they said, and I'll quote here, unfound claims linking COVID-19 vaccines to infertility have been scientifically disproven. ACOG recommends vaccination for all eligible people who may consider future pregnancy. Further, they recommended that pregnant individuals have access to the vaccine for vaccination. And finally, they actually recommended vaccines for lactating and non-lactating mothers who've just delivered. So the data is pretty good on this one. It's a fairly common myth that's floating around in the internet and social media right now. It's a great question, David.
So it sounds like the vaccine is safe for expectant mothers.
It is.
That's wonderful.
It's also interesting, David, in that when the expectant mother, one article that I reviewed showed that when the expectant mother got vaccinated, she actually passed those antibodies on to her expectant child, her fetus, and then her child. And those protective antibodies lasted about 3 months, which is really great. The other thing that's kind of interesting is that in the lactating woman who feeds breast milk to her child, that actually also contains the anti-COVID antibodies. So it actually, you're conferring some immunity to your newborn by getting vaccinated.
Now, tell me a little bit about the natural state of motherhood and expectant mothers. Do other things in terms of immunity get passed on to children, within the womb,
Yes,
or is that just COVID-19?
So some things do and some things don't, and that's why God made OBGYNs. Although I'm married to one, there's a whole list of things that I don't remember, because I can ask my wife about what gets passed on and not. And so the best advice I have there is to ask an expert, and that's a really great way to do that.
So circling back to sort of, the older population, does the vaccine, will it actually protect me from COVID-19?
It's interesting. We've given over 300 million doses here. There's about as of today, which is in early June, there are about 173 million people who've been there's about 173 million people who've been vaccinated at 1 dose or 2 doses. And the data that's shown out there is that all 3 of the vaccines that are licensed for use here in the United States have they're just great vaccines. They have a fantastic use profile. Said another way, that if you get a vaccine and you get exposed to COVID, 93.8% of the people in the Pfizer and the Moderna, same sort of number, don't get COVID. And those people who do get COVID, the small number who do get COVID, actually get a very mild form of the disease, and they don't usually get admitted to the hospital and usually can surf it out at home. It's interesting. One of the things that's now coming up is will it protect me from the variants? And so far, the vaccines that are out there are very good at taking good immunity, protecting you from these variants that we know about so far. In one study that I looked at, there were about 101 million people in this study, And they asked, well, what about what's so-called breakthrough infection? Meaning, if I got vaccinated, would I get a breakthrough infection? And in that 101 million people in that data set, there were 10,262 people who got breakthrough infections, or about 1 in 10,000. 27% of those people were asymptomatic. 10% of those people were hospitalized. So about a 1 in 100,000 people who got vaccinated got hospitalized. And 2%, or about 160 of those people, died. So 1 in a million people died. And the people who did die, their average age was 82 years old, with a range of 71 to 89. And of those people who died, 160 people died, 28 folks died from something else besides COVID. So chances are, if you're relatively young and healthy and you get a vaccine, small chance of breakthrough, even smaller chance of hospitalization, and 1 in a million chance. If you're in that older eighth decade of life, 1 in a million chance you're going to die. It's also interesting too, David. I think you might be thinking about this question is, well, what if I've got, if I'm immunocompromised, I've got a disease, or I've got cancer? Do these vaccines work? And that would be a great question as well. It's turning out that there's a way to give these vaccines for those people, and you should probably consult your either cancer doctor or the doctor that's treating you if you're immunocompromised or have cancer. But the data that I'm seeing shows that if you're immunocompromised or have cancer, you can get great immunity with this vaccine set. But it's probably one where you ought to talk to your provider, your doctor, yourself.
And by immunocompromised, do you mean immunocompromised people that are on medication, say for other conditions such as rheumatoid arthritis or inflammatory bowel disease, or people with HIV and AIDS? Or are we talking all populations that are immune compromised?
The data I've seen has been on both those who have they're naturally immunocompromised, or they're given a drug that would suppress their immune system. So,
and tell me, the vaccine, I'm a little bit curious. I don't want to be shedding virus onto people who haven't been vaccinated. And so, if I get the COVID-19 vaccine, will I shed virus and put other people at risk?
If you have the COVID vaccine, you're not going to get you're not going to shed virus from that vaccine. Like we said, it's just a little piece of the virus itself that you're introducing to your body so it can recognize it. There is a caveat here. If you do get COVID and you've been vaccinated, remember we talked, it's a pretty rare event. If you get COVID, it's like 1 in 22,000 or something like that. You could shed asymptomatically. But that's a rare event. The other thing that we've noted is that if you have the vaccine and you have COVID and you're around people who are vaccinated, it's likely that they're not going to get COVID as well.
Tell me a little bit about this number, 70%, that I keep hearing about in the media, of we need to get 70% people vaccinated. What does that mean?
That's a great number. It comes from a concept of herd immunity that was put together with this thing called Bayes' theorem. And it's got a lot of science behind it. But the idea is that if you have 70% of the people who are immunized to anything, there's not as much of a reservoir in the community, so that when a person gets infected with the virus, if that person is surrounded with other folks who have immunity, it is unlikely to catch on. And so that's the magic number. Some people dispute whether that's the right number or not. Obviously, the higher the immunity rate is, the better off we are. But 70% seems to be a pretty good number.
Will this stop the pandemic?
I don't think so. I think what's going to happen is that it's like flu in 1918 or HIV or any of the things that we've had come along. And I suspect that what's going to happen with this flu, this virus, is it will mutate, and we'll kind of be like the flu every year. We'll just get a booster shot and we'll be off and running, and it'll be something that's there, but we'll learn how to live with it.
Talk to me about long-term side effects from the vaccine.
There are not really any long-term side effects of the vaccine. There's some long-term side effects of having COVID, these long haulers that we talked about. And there's not a whole lot written about long haulers yet, because I think today's 503, the world has experienced the COVID virus for 503 days. And so we don't know a lot about the long haul symptoms of either COVID or its long-term consequences. What we do know is that people who have long haul symptoms now, if they get, and I've seen this mostly with the Pfizer vaccine, if they get a vaccine, their symptoms seem to abate and they seem to get better.
Now, I have two daughters that are vaccinated from COVID-19, ages 17 and 21. I have one that's 11 and her birthday's coming up in July. And then I have a 9-year-old. And I'm just thinking about, with respect to my third daughter who's turning 12, Josie, how does this vaccine affect children?
The Pfizer vaccine has been approved, and Moderna is FDA going through its final approval process for use in folks age 12 and above. And it's turning out to be very effective. In fact, the MMR presented a paper that was released on June 4th that was kind of interesting about kids and COVID. And it's not rare. The hospitalization rate is 2.1 per 100,000 kids, which is 3 times higher than the flu, influenza. If you get flu and get put into a hospital, it's 3 times higher than the flu rate. The other thing that's kind of interesting is that in communities that have COVID, kids of your daughter's age, the 8 to 12-year-old kids, have been shown to have the COVID at the same rate that adults do in that community. And so if your community has an outbreak, it's likely the kids have the same outbreak. So of those kids hospitalized, 71% of them had an underlying condition of some sort. But what that means is 30% didn't. So a third of the kids who got admitted didn't really have any reason to get admitted to the hospital. 32% of those kids who got admitted had an ICU stay of some sort. So if a third of the kids that got admitted didn't have any underlying condition, and a third of those kids who got admitted went to the ICU for one part of that or another.
There's this term that came out that I read about a lot called vaccine hesitancy. Mm-hmm. And I'm just wondering, if you were seeing somebody clinically or you had any advice for people that were vaccine hesitant around COVID-19, what would you say to them and how would you reassure them?
It's interesting. There are people in my family and some good friends who are vaccine hesitant. And honestly, I understand the hesitancy. I mean, everybody should be really a little bit skeptical of things that we put in our body and ask questions about them. The thing that I would advise you to do is seek the best counsel you can. I mean, find a trusted advisor, somebody in healthcare who's a physician who actually might have spent a little bit of time reading about this stuff, because there's a lot of things out there that and this literature changes every day. It really does. And seek their counsel. There's a lot of just really bad information that is not very helpful to making a good decision. And seek the facts. And then make your own judgment about what's useful for you and weigh your benefits and risks. I am vaccinated. Everybody in my family has come around to the point where they get vaccinated. The risks of getting COVID are worse than the risks of getting vaccinated. And so it's a relative risk kind of question. And of course, nothing that we do is risk-free, but in the grand scheme of things, this is a pretty safe vaccine.
Yeah, I will say, still working clinically in the hospital, I've taken care of many people diagnosed with COVID-19 pneumonia, and it is a very difficult disease process to treat and to watch.
Well, I'll flip the question to you, David. What would you say to someone who's vaccine hesitant?
We have this discussion a lot with family members who don't want to be vaccinated, but have older members in their family. And I talk to them a little bit in terms of the importance of being part of a community and a population that's trying to beat back a pandemic and bring it back to something that's regular, like you said, the flu season or something such as that. And to really think of everybody in the community and not just ourselves. And I think that's why I was so willing to get vaccinated early. And I did. I put my faith and my trust in the science behind it, which can be difficult sometimes. But I made that choice for myself. My kids made their own decision and elected to get vaccinated. So like you, I say, do the research, do the homework, and ultimately make your own decision, but please take into account the larger community as well, and people that truly can get devastatingly ill from this disease process, because I've seen it, and it's very, very sad.
The other sort of plug there is for you talked about providers. I mean, if you think about the people taking care of these folks, they've been at it 502 days now, and a lot of them are really burnt out. The resources they have to take care of other folks who are ill are getting kind of thin, and it's really hard to be a provider in this environment right now.
The other thing that I think of in terms of that is reopening, and I think that's so important, because the next wave that I'm seeing come into the hospital and caring for are issues with substance abuse, and
Yep.
I believe that it's just social isolation and loneliness, and so the faster we can reopen to address those types of things by beating back this pandemic, I think is the better for all.
100%. Well, David, it's been really great to have this conversation with you today.
And thanks, Dr. McEachern. I appreciate your openness and willingness to discuss all of these questions. I know it's not easy to keep up with this rapidly changing literature, and you just do an amazing job at it.
Well, thank you.